When I got pregnant with my third baby at 38, my medical chart said advanced maternal age. I'm not ancient. I'm in my 30s. But medically, pregnancy after 35 does come with some different considerations. Today, I'm explaining what actually changes when you're pregnant over 35, the real risks, the unnecessary fears, and why this label exists in the first place. Because more women than ever are having babies after 35. And you deserve facts, not fear. Hey everyone, I'm Diana and welcome back to Sweet Pregnant. I'm a doctor specializing in women's health and I'm a mom of 3. And here's what I want to address right away. The term geriatric pregnancy is outdated and frankly offensive. Most doctors now use advanced maternal age instead, though that's not much better. The truth is, 35 is just a number where certain risks start to increase statistically. But increase doesn't mean guaranteed, and many of those risks are still very small. Plus, there are actually advantages to being pregnant in your late 30s or 40s that nobody talks about. So today, I'm giving you the complete picture, the risks, the benefits, the extra monitoring, and how to have the healthiest pregnancy possible after 35. Let's start with why 35 became the dividing line. The age 35 wasn't chosen randomly. Back in the 1970s and 80s, amniocentesis was the only way to definitively test for chromosomal abnormalities, like Down syndrome. But amniocentesis carries a small risk of miscarriage. So doctors needed to figure out when the risk of chromosomal issues was high enough to justify the risk of the test. They looked at the data and found that at age 35, the risk of Down syndrome is about 1 in 400. That's when it starts to become more statistically significant. So 35 became the cutoff for offering amniocentesis and increased monitoring. But here's the important part. Risk doesn't jump dramatically at your 35th birthday. It increases gradually as you age, starting in your 20s and continuing through your 40s. 35 is just the point where the medical community decided to pay closer attention. The landscape has changed. We now have non-invasive prenatal testing that's incredibly accurate and carries no risk to the pregnancy. We have better ultrasounds, better prenatal care. So while 35 is still used as a marker, it's less meaningful than it used to be. And critically, the majority of women over 35 have completely healthy, uncomplicated pregnancies. Let's talk about what actually changes when you're pregnant after 35. I'm going to give you the real statistics, not just vague statements about increased risk. Chromosomal abnormalities. This is the big one everyone worries about. The risk of Down syndrome and other chromosomal issues does increase with maternal age. Here are the actual numbers. At age 25, risk of Down syndrome is about 1 in 1, 250 at age 30, about 1 in 950 at age 30. 5, about 1 in 400 at age 40, about 1 in 100 at age 40. 5, about 1 in 30. So yes, the risk increases. But even at 40, 99 out of 100 babies do not have Down syndrome. Context matters. Miscarriage risk. Miscarriage risk also increases with age, primarily because of increased chromosomal abnormalities. In your 20s, miscarriage risk is about 10 to 15% in your 30s, about 15 to 20% in your 40s, about 25 to 35% again. This means that even in your 40s, the majority of pregnancies continue successfully. Gestational diabetes. Your risk of developing gestational diabetes is higher after 35, partly because your body becomes less efficient at processing insulin as you age. But gestational diabetes is very manageable with diet, exercise, and sometimes medication, and it usually resolves after delivery. I had gestational diabetes with my third pregnancy at 38. I checked my blood sugar, adjusted my diet, and everything was fine. Preeclampsia, the risk of high blood pressure, and preeclampsia is moderately higher in women over 35. This is why blood pressure monitoring is so important throughout pregnancy. Early detection allows for management. Placenta previa and placental abruption. Slightly increased risk of placenta issues, which is why ultrasounds carefully check placenta location and health. Multiple pregnancy. Interestingly, you're more likely to conceive twins naturally after 35 because you're more likely to release multiple eggs during ovulation. This isn't necessarily a risk, but it does change the pregnancy. Preterm birth, slightly higher risk of delivering before 37 weeks. C-section, if this is your first baby and you're over 35, you have a higher chance of needing a C-section. This is partly because labor may progress more slowly, and partly because doctors are sometimes more cautious with older first-time moms. Now, here's what's important to remember. All of these risks are statistical. They're population level data. They don't determine your individual pregnancy outcome. A healthy 38-year-old who exercises, doesn't smoke, and has no chronic health conditions may have a lower risk pregnancy than an unhealthy 25-year-old. Your overall health matters more than your age alone. Let's talk about something that never gets mentioned. The advantages of having a baby after 35. Financial stability. By your mid to late 30s, you're more likely to be established in your career and financially secure. You can afford better health care, a safe home, childcare, and all the things babies need without as much stress. Emotional maturity. You've lived more life. You know yourself better. You're more confident in your decisions. You're less likely to be swayed by every piece of conflicting advice or to panic over every little thing. Relationship stability. If you have a partner, you've likely been together longer and have a stronger foundation. You've probably worked through major relationship issues and know how to communicate and support each other. Career accomplishments. Many women in their 30s and 40s have already achieved career goals, so they feel less conflicted about taking time for maternity leave or adjusting their work schedule. Life experience. You've traveled, you've made mistakes, you've learned from them. You feel more ready to be a parent. Interestingly, some studies suggest women who have babies later in life may have lower rates of postpartum depression, possibly because they're more emotionally prepared and have better support systems. Older moms tend to make healthier lifestyle choices during pregnancy. My experience. I had my first baby at 32 and my third at 38. I was a better mother at 38, not because I loved my third child more, but because I was more patient, more confident, and less anxious. Age gave me perspective. If you're pregnant after 35, you'll have access to more testing and closer monitoring. This isn't because something's wrong. It's preventive care. First trimester screening, NIP non-invasive prenatal testing. This is a blood test you can do as early as 10 weeks. It analyzes cell-free fetal DNA in your blood and screens for Down syndrome, trisomy 18, trisomy 13, and sex chromosome abnormalities. It's highly accurate, over 99% for Down syndrome detection, and it carries no risk to the pregnancy. This test has been a game changer. When I was pregnant at 38, NIP gave me so much reassurance. NT scan nuchal translucency. This is an ultrasound done between 11 and 13 weeks that measures fluid at the back of the baby's neck. Increased fluid can indicate chromosomal abnormalities. This is often combined with blood work for more comprehensive screening. Diagnostic testing. If your screening tests come back with concerning results, you may be offered diagnostic testing. Amniocentesis. Done between 15 and 20 weeks. A needle is inserted through your abdomen to collect amniotic fluid for genetic testing. It's definitive but carries a very small risk of miscarriage, less than 1 in 400. CVS chorionic villus sampling. Done between 10 and 13 weeks. Similar to amniocentesis, but samples placental tissue instead. Also definitive, with a similar small risk. Second and third trimester. More frequent ultrasounds. You may have additional ultrasounds to monitor the baby's growth, amniotic fluid levels, and placenta function. Non-stress tests starting around 32 to 34 weeks. You might have non-stress tests where they monitor the baby's heart rate and movement. This ensures the baby is doing well as you approach delivery. Blood pressure monitoring. Because preeclampsia risk is higher, your blood pressure will be checked at every appointment. You might even be asked to monitor it at home. Glucose testing, same as any pregnancy. But because gestational diabetes risk is higher, your doctor will pay close attention to those results. The goal of all this testing, early detection. If Teresa's a problem, knowing about it early allows for intervention and better outcomes. Most of the time, all these tests come back normal and reassure everyone that the pregnancy is progressing beautifully. So what can you do to optimize your health and your pregnancy if you're over 35? Preconception planning. If possible, see your doctor before you get pregnant for a preconception checkup. They'll review your medical history, check for any chronic conditions that need to be managed, and make sure you're taking prenatal vitamins with folic acid. If you have conditions like diabetes, high blood pressure, or thyroid disease, getting them under control before pregnancy is ideal. Prenatal vitamins. Start taking a prenatal vitamin with at least 400 micrograms of folic acid at least 1 month before trying to conceive. Folic acid is critical for preventing neural tube defects, and it's most important in the earliest weeks of pregnancy. Maintain a healthy weight. Being overweight or underweight can complicate pregnancy at any age, but especially after 35. Work toward a healthy BMI before conceiving if possible. Exercise regularly. Moderate exercise during pregnancy is safe and beneficial. It can reduce your risk of gestational diabetes, preeclampsia, and excessive weight gain. Walking, swimming, prenatal yoga, and strength training are all great options. I walked almost every day during my 3rd pregnancy. It kept me sane and healthy. Eat a balanced diet. Focus on whole foods, lean proteins, healthy fats, and plenty of fruits and vegetables. Limit processed foods, sugar, and excess sodium. Don't smoke, drink alcohol, or use recreational drugs. These are harmful at any age, but the risks compound with advanced maternal age. Manage stress. Chronic stress isn't good for you or the baby. Find healthy coping mechanisms, meditation, therapy, exercise, time with loved ones. Attend all prenatal appointments. This is critical. Regular monitoring allows your doctor to catch and address any issues early. Don't skip appointments, even if you feel fine. Educate yourself, take childbirth classes, read reputable books, watch educational videos. Knowledge reduces fear and helps you make informed decisions. Build your support system. Whether it's your partner, family, friends, or a therapist, make sure you have people you can lean on. Pregnancy and parenting are hard. You don't have to do it alone. One more thing I want to mention. Why? Your body has done this before. Your uterus knows how to labor and deliver. You're less likely to need interventions. Even though age-related risks like chromosomal abnormalities are the same, the overall pregnancy and delivery tend to go more smoothly. With my 3rd baby at 38, yes, I had more ultrasounds. Yes, I had nipped and close monitoring, but the pregnancy itself felt easier than my first 2. Maybe it was because I knew what to expect. Maybe it was because my body had done it before. Probably both. Labor was also shorter. Recovery was faster. So if you're over 35 and considering a 2nd or 3rd baby, don't let age alone scare you. Talk to your doctor about your individual situation. But know that many women have healthy pregnancies well into their 40s. Here's what I want you to take away from this video. Yes, pregnancy after 35 comes with increased risks, but those risks are still relatively small for most women, and they're manageable with good prenatal care. The label advanced maternal age is clinical, not a judgment. It's a marker that tells your healthcare team to pay closer attention. That's a good thing. You have access to better testing and monitoring than ever before. NIP, detailed ultrasounds, and close follow-up mean that potential problems are caught early. Many of the risks are within your control. Staying healthy, maintaining a good weight, exercising, eating well, and attending all appointments make a huge difference. There are real advantages to being an older mom: financial stability, emotional maturity, life experience, and relationship strength all contribute to successful parenting. Every pregnancy is individual. A healthy 38-year-old can have a better pregnancy than an unhealthy 25-year-old. Your overall health, lifestyle, and genetics matter as much as or more than your age. I had a wonderful pregnancy at 38. Yes, I had more tests. Yes, I was monitored more closely, but my pregnancy was healthy. My labor was smooth, and my baby is thriving. If you're over 35 and pregnant or trying to conceive, don't let fear dominate. Work with your doctor. Stay informed. Take care of yourself, and trust that your body is capable of amazing things no matter your age. If this video helped ease your worries or gave you useful information, hit that subscribe button. My next video is all about baby milestones in the first year and when to actually worry versus when to relax. Drop a comment. How old were you when you had your baby? Or how old will you be? Let's normalize pregnancy at all ages. You've got this. Age is just a number, and you're going to be an amazing mom. I'll see you in the next one.